office jongka district tuberculosis office riboy district ne kasngi ga khandai tri no pra kala plait pait ba ïaka program ban pen sapriang ïaka khubor shaki pait ba halor ka jingpang tb kabala tip kum ka 100 days TB awareness campaign hagak tin nongway kabalong kum shibynta ban ïaleh pyrshah ïaka jingpang TB bat ban pen sapriang ïaka khubor shaki nongsong shnong halor ki dak kitchen bat kilat jingyada na kane ka jingpang ïaka te ka program na penlong ha science hall hanongpo hariboy district ha kabalawan wan plait pait ba do ba meral bonds im u MLA kanongpo kumu kongsan ha ka jingyadon lang ka kong birani ADC riboy district kum ka sembut kongsan bat lawan mani don lang ru da ka Dr. Kalwing district tuberculosis officer riboy district ka Dr. Dibla medical superintendent civil hospital nongpo u Dr. B Light Plang district MCH bat Dr. Angel JU Kharduit district medical health officer lembat kiwe ha kani ka sngi na kalyang ka office district tuberculosis office riboy district kala plait pait ba ya artli ki ambulance ki bansalej ban rung shakishnong ba pher jong ka thain riboy na ka banta ban pan sapriang ya ka khubor halor ka jingpang TB da ka jingtmu ban rat dengkhong ya kani ka jingpang na kalyang ka office district tuberculosis officer kala samru ya ki khusnam sha ki company bat kiwe ki riushimet ki badon banta ban tingkhun ya ki nongpang TB da ka penbiang iki marbam ha kapor ka bakidang di dawai kitei ki nong tingkhun iki nong pang TB la ne ki nekshai mitra ki kenthup yu ba sosten sotun ubadei UMLA ka jirang Mathan Alloy Limited Shamfero Century Limited Pioneer Carbine Limited Nezone Pipe bat NTC Structure bat ka Umroy Madan VHC
And we have seen significant changes has been there at the ground, where in present day, we must say that leprosy is, if it's not 100% also, it is almost eradicated or eliminated from our society. In due course of time, due to evolution, due to increase of population, due to the dynamics of different social activities in our society, we have witnessed many diseases have started to increase within our society. There are challenges for the government to address. Despite of all these challenges, we have seen different policies have been framed. In the early 2000s, where the National Rural Health Mission, one of the very important missions that has been launched to address healthcare system within our country. We have seen significant changes in terms of infrastructure, in terms of facilities, in terms of equipment, and how to tackle all these issues within our state. And today we are here to launch a very important campaign that is against tuberculosis, jingpang TB, which is very much prevalent within our state. The effort that has been taken in the past, we have seen today while presenting the award to the different nature mitra who have supported to the TB patient. And we have seen the participation of different communities, civil societies, NGOs, and especially ASHAs who are there at the ground to bridge the gap between the health system and the public at large. We cannot deny the fact, despite of many challenges which is there, due to shortage of manpower, due to shortage of resources with the government, it is not an easy task. But despite of that, in the budget provision for the year 2024-25, where the state government has earmarked more than 1,971 crore, which include our revenue and